A map, a camera, and a pair of shorts.
What you want is family, but what you get is just what you see.
Alright, so here I am outside the building that is going to laser my eyes, so this may be the very last time that you see a man, a camera, a pair of shorts, and a pair of glasses. Alright, now you get to wear these. No astigmatism. I got stars.
Have you seen the procedure done before?
I have actually. I've seen some friends go through it.
Okay. I need to take your blood pressure. Okay. You do have some astigmatism.
Yep.
So we're going to take you over and put some numbing drops in your eyes. And then we're going to put a little mark at the 6 o'clock spot on your eye, just a reference point to treat your astigmatism.
Okay.
And then they'll take you over to the cleaning table and clean your eyes. After they clean your eyes, they'll take you into the laser room. And they will put a patch over your left eye. It's just a piece of tape, and then a occluder patch over your left eye.
Okay.
Then they'll start on your right eye, and they put a little bit of tape just to hold your eyelashes out of the way. Then they put a lid holder in, more numbing drops. And then they
I like the idea of more numbing drops.
as many as you need.
Oh really? I can just say more.
We've got plenty. Then we put a suction ring on your eye.
Okay.
And when the suction ring goes on, you do feel a little bit of pressure. You shouldn't feel any pain, just some pressure.
I shouldn't, so if I do, I'm doing it wrong?
You're doing it wrong. Well, when they put that suction ring on, your vision goes dark.
Yeah.
That's normal. It's supposed to go dark, so don't worry about that.
Okay.
Then they put the hands tome on. The hands tome just slides across your eye, across the suction ring. You'll feel a little bit of a vibration. There is a motor in it, so you'll hear some buzzing sound.
Okay.
When they lift that machine off, your vision does return, and you're looking at a bright white ring of light with a red blinking light in the center.
Okay.
That is your fixation point.
All right.
When you're looking at that light, try not to focus really hard, because when they lift your flap, it turns into a big red blur.
Sure.
And you cannot focus that. So find a spot in the center to fixate. The better you fixate, the better your treatment's going to be. Just relax and listen. You'll hear the laser start. It's a loud tapping sound.
Nick, are you ready?
I hope so, sir. Are you ready? All I care about is whether you're ready.
I'm ready. I'm ready. Now that's interesting.
So what makes an excimer laser? I mean, I know that they make hydrogen lasers, which of course will burn a hole right through you. And then there are like LED lasers they use in CD players that don't basically do anything.
Right. This is a cold laser that actually just, the gases that are used in the laser actually vaporize the tissue. It removes the tissue from the cornea.
So this isn't a light that one can actually see?
No, you can't see it.
Is it satisfying working in an area like this where you...
Oh, I can't even begin to describe how satisfying it is. And what's really satisfying is to have the patient get up off the table and be able to actually see.
This is our little pal we're squeeze on to.
Is that to avoid people squeezing you? Strangely, all this, while looking uncomfortable, really wasn't. The sensations, if any, were subtle, and at no time was there any pain and obviously no blood. The procedure consists of making a very shallow C-shaped incision, peeling back the flap, and then lasering the part underneath, then putting the flap back. The laser pulses were imperceivable for me, but what was so very obvious was being in the care of a highly skilled, well-trained team who made the experience not just bearable, but actually pleasurable.
Nick, your vision will be actually pretty good when you sit up here. But now it's not as good as it's going to be tomorrow.
But nice grip there, Nick.
Do I? I just fell asleep.
Yes. Let me help you up.
Okay.
Open your eyes. Look around.
Yeah, it's just like soft focus. It's like,
Are you able to see on the off there, Nick? Are you able to tell what time that is up there?
oh yeah. 5:06 is quarter to 6. The whole procedure took just about 10 minutes for both eyes, and by now any anesthetic had worn off, and I felt just fine. Those eye shields are there just to prevent me accidentally scratching my eyes, especially when sleeping. They're only worn for the first day and then only at night for 5 days. P-A-E-T. There's an L in there and an F and something. I can see it.
But you just can't distinguish. Okay,
Yeah.
good. So you're 2020 with a couple on the 2015 line. Let's try your other eye.
There's an F and something and a T and a L and a...
Okay. So you're 2020 in the right eye plus a couple on the 2015 line. You're 2025 in the left eye.
Oh, okay.
So that's excellent. That's really good.
I am happy.
Okay, now your vision is a little between 2015 and 2020 in the right eye. And your vision is between 2020 and 2025 in the left.
Yeah.
With just we're a quarter of a diopter overcorrected in the left, and that will revert back, and with that quarter it brings you down to 2020. In other words, that's perfect.
It's been changing. I noticed last night there was a more radical difference between the two, and now it's just...
You're going to notice a little bit of fluctuation for a couple of days, maybe even up to a month. You'll notice, but very minimal.
Yeah.
Very minimal.
Even when it's bad, it's good. The very next day, I woke to better vision actually than my glasses before, and no sensation of pain or discomfort. My thanks must go to Dr. Wilkinson's team at Rocky Mountain Eye Care Associates and Clear Vision Laser Centers for restoring one of life's most precious senses.